California lawmakers are working on solutions as hospitals and ambulances continue to be overwhelmed with the latest COVID surge.
At least one local hospital declared an internal disaster earlier this week because of the flood of patients. CBS 8's Dana Marie McNichol live in Chula Vista now with more on this. Dana Marie?
Good morning, Eric. Well, I'm here at Sharp Chula Vista where, yes, they did declare an internal disaster because 70 patients were overwhelming their emergency room. There was not one bed open in their emergency department. Now, they were able to end this emergency declaration because they moved patients into other departments. They do say they're out of the woods, but COVID patients continue to flood the halls. Now, this does come right as EMS workers from around the state of California come to talk to lawmakers this week about extremely long wait times from their ambulances and when they arrive to hospitals, when patients actually get a bed in that hospital. Some are even saying this is the most significant medical crisis in the state, where reports are surfacing about how ambulances are waiting for as long as 8 hours for patients to get a hospital bed, which is very, very dangerous. Now, on Wednesday, the California State Assembly Committee on Emergency Management held an oversight hearing about how this problem has been decades in the making, but has only recently been exacerbated by staffing shortages and high demands because of the latest COVID-19 surge. Assembly member Freddie Rodriguez spoke about this at the meeting.
People are waiting for ambulances. People are waiting for treatment at hospitals, and it shouldn't be that way, especially this day and age. I know there's a pandemic, but we need to elevate ourselves. What do we do differently so that way we can make sure that at the end of the day, people get quality care and service when you're going to a hospital?
Well, Assemblyman Rodriguez was speaking about what we can do differently. So some solutions were proposed, like fining hospitals if ambulances were waiting more than 20 minutes. So they say that new legislation would really make a difference, as these EMS rules and laws were established over 40 years ago. And of course, we're nowhere near where we were 40 years ago, and not in a pandemic. So back live here in Chula Vista, we still know that internal disaster was declared resolved, but COVID patients are still overwhelming their emergency department.